আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহি ওয়া বারাকাতুহু। সবাইকে স্বাগত জানাচ্ছি বাংলাদেশ হোমিওপ্যাথিক পরিষদের অনলাইন ভিত্তিক উচ্চতর প্রশিক্ষণ ক্লাসে। উপস্থিতি আপনারা জানেন প্রতি বুধবার বাংলাদেশ হোমিওপ্যাথিক পরিষদের পক্ষ থেকে এই অনলাইন প্রশিক্ষণ ক্লাসটি পরিচালনা করছি। আমাদের এই উচ্চতর প্রশিক্ষণ ক্লাসটি আমরা বিষয়ভিত্তিক আলোচনায় প্রথমে ইংরেজিতে এবং পরবর্তীতে আবার বাংলায় আলোচনা উপস্থাপনের চেষ্টা করি। আমাদের এই আলোচনায় দেশ-বিদেশ থেকে অনেকেই উপস্থিত থাকেন। সবাইকে আমরা আন্তরিক ধন্যবাদ জানাই। আপনারা ক্লাসের শেষ পর্যন্ত উপস্থিত থেকে আমাদেরকে সঙ্গ দিয়ে হোমিওপ্যাথিকে সমৃদ্ধ করার জন্য যেই পরিশ্রম আপনারা করছেন, এই জন্য আপনাদের সকলের জন্য দোয়া থাকলো। সাথে, সাথে একটি বিষয় সবাইকে স্মরণ করিয়ে দিই, আপনারা ক্লাসে উপস্থিত থাকার সময় অনেক সময়ই অজ্ঞাতসারি অথবা কারিগরি সমস্যার কারণে আপনাদের মাইক অথবা ভিডিওটি আনমিউট হয়ে যায়। সেক্ষেত্রে অন্যদের ক্লাসে উপভোগ সমস্যা তৈরি হয়। আপনারা এই বিষয়টি একটু খেয়াল করবেন যেন সচেতনভাবে কারো মাইক অথবা ভিডিও যেন আনমিউট না হয়ে যায়। আর আপনারা যারা আমাদের ক্লাসে উপস্থিত আছেন, আমাদের ক্লাসে যদি পার্টিসিপেন্ট বেড়ে যায়, অনেক সময় ঝামেলার কারণে আপনারা আবার পুনরায় ক্লাসে জয়েন করতে আপনাদের অসুবিধা হয়। সেক্ষেত্রে আপনারা বাংলাদেশ হোমিওপ্যাথিক পরিষদের ফেসবুক পেজে গিয়ে আমাদের এই ক্লাসটি উপভোগ করতে পারবেন। আজকে আমরা যে আলোচনাটা করব সেই আলোচনার ঘোষণা আমাদের সম্মানিত বাংলাদেশ হোমিওপ্যাথিক পরিষদের সভাপতি স্যার আগেই ঘোষণা দিয়েছেন। তারপরে আমরা আরেকবার আপনাদেরকে স্মরণ করিয়ে দিতে চাই, কেস টেকিং, রেমেডি সিলেকশন অ্যান্ড সেকেন্ড প্রেসক্রিপশন এই বিষয়ের উপরে ইংরেজি ভার্সনের ৩য় পর্বের আলোচনা হবে। আলোচনার শেষের অংশে আমরা প্রশ্নোত্তর অথবা মন্তব্য নেব। সেখানে আপনারা বাংলা অথবা ইংরেজি যে কোনো ভাষায় আপনারা প্রশ্নোত্তর করতে পারবেন, কিন্তু আলোচনাটা হবে ইংরেজিতে। তো খুব বেশি কথা আর না বাড়িয়ে সরাসরি আলোচনায় আমন্ত্রণ জানাচ্ছি বাংলাদেশ হোমিওপ্যাথিক পরিষদের সম্মানিত সভাপতি ডক্টর শেখ ফারুক ইলাহি স্যারকে। স্যার, প্লিজ কন্টিনিউ ইউর প্রেজেন্টেশন। থ্যাংক ইউ।
Thank you, Dr. Patwari, for your introduction. Let us start our lecture on case taking, remedy selection, and follow-up. We already covered case taking, and today we'll continue for remedy selection, and maybe on next lecture follow-up or second prescription. So let us go to the slide where we ended in the last lecture. These are case taking Dr. Honeyman, who we already discussed in details. We said that in case taking, we want to take all the symptoms of the patients, and we categorize the symptoms into 3 parts: particular symptoms or organic symptoms, then general symptoms, and then mental symptoms. So we discussed already how to take all these symptoms. Then in organon, Honeyman said to go for examinations and write the findings, because when you take the history, you will have to observe some pathological changes in parts or organs of the body of the patient, and you will have to record also such changes. So these are called examination or clinical examinations. We categorize this thing into 2: general examinations and systemic examinations. General examinations we already discussed, so I'm not going into details. Then we go for systemic examinations. It means you will have to examine the system of which the patient gives maximum symptoms. Say a patient came to you for respiratory symptoms. He came for bronchial asthma or chronic cough or something like this. In that case, you will have to examine the respiratory systems in detail. Or say, for example, the patient came to you for, say, tonsillitis, chronic tonsillitis. In that case, you will have to examine the throat in detail and other system just in brief. So these are the specific systemic examinations: examination of the respiratory system, examination of the cardiovascular system, examination of the genitourinary system, examination of the nervous system, examination of the ear, nose, and throat. We'll discuss in details in our paid class, which will be started very shortly by our Bangladesh Samvitik Parishad. There we will discuss all these things in very details. All these examinations, clinical examinations. After clinical examinations, you have completed the history. Now you will think how to make the prescription, how to select your medicine. Then we said that Hahnemann gave hints in 2 aphorisms about this thing, about remedy selection. So in aphorism 153 and 154, he said that after taking the case history in details, you will have to sort out the important symptoms, the characteristic symptoms of the patient, the unusual, uncommon, and peculiar symptoms and signs in the patient. And you will try to find out a simile on the basis of these uncommon symptoms only, not to take into consideration all the common symptoms and particular symptoms. So we'll have to know, if you want to know what are the uncommon symptoms, then you have to know the common symptoms. How to know the common symptoms? The patient came to you, say for example, for bronchial asthma. Bronchial asthma has common symptoms of difficult respiration. And this difficult respiration, of course, most of the patient will feel by lying down. So these are common symptoms. Gets better only by lying down with dyspnea. This is peculiar symptom. So when you know the common symptoms of the diseases, then you can find out what are the uncommon symptoms. That's why we say that you will have to learn practice of medicine well. Then only you know what are the common symptoms of the disease, or we can say what are the pathognomonic symptoms of disease. So for that, you will have to study practice of medicine, practice of homeopathic medicine, this subject. It is not our subject here. That's why we are just skipping it for other lectures. Now, to know the uncommon symptoms, we'll have to know classification of symptoms. These are related one with another. So classification of symptoms, there are many ways of classifying symptomatopathy by many authors. But what I find myself, this classification given by Dr. J.T. Kent, it is the best. So he classified all the symptoms into 4 groups. One is general, then particular, then common, then uncommon. There are some authors who criticize this classification, but I find this is best. These general symptoms means symptoms taking into consideration of all the parts of the patient as a whole. This is general symptoms. The symptom signifies the patient as a whole. But this we can or can't classify it into 2 again. One is mental general, one is physical general. Mental general. Another is physical general. And particular is particular. Particular means symptoms belonging to each organs or parts of the body. These are particular symptoms. Then he classified again common and uncommon. This common symptom may be from general symptoms, maybe from particular symptoms. What is this? Is from general symptoms, you see. General symptoms, say for example, if somebody says that I get exhausted in hot sun. You see, this is a common symptom. Anybody is exposed to hot sun, He'll be exhausted. He cannot tolerate heat of the sun. So this is a common symptom. But if he says that he likes and he gets better by exposing him to sun heat, this is uncommon. Again, say mental symptoms. If somebody says that he is afraid of tigers, you see, this is a common mental symptom, because anybody and everybody will be afraid of tiger. Who is not? But if somebody says he is very much afraid of cockroach, you see, cockroach is a harmless insect. And if cockroach comes to some female, as if she is going to die, this is uncommon. So you see, common and uncommon both signifies symptoms from general and particular. So I think this is the best classification, primary classification of symptoms. Then there are so many types of symptoms classified in homeopathic medicine. I found at least more than 50 types of symptoms enumerated in homeopathic literature. More than 50 types, maybe 70, 80 types. Some are here, I put it here for you. Say one is subjective and objective symptoms. We know all. Subjective symptoms means which only the patient can feel. Patient says, I'm hungry, you see. You cannot see his hunger, but only he can feel. So this is subjective. Objective symptoms which you can see. Patient says, I am febrile. And you examine by a thermometer, you find this is, say, 40 degrees centigrade. Or patient says, I have pain in throat. You examine the throat, you find there is a big pair of big tonsils, inflamed, and maybe there are pus points. So these are objective symptoms. This is simple. What the patient says, patient feels, this is subjective. And what the doctor examines and finds, this is objective symptom. Then organic symptoms and functional symptoms. Some pathological symptoms. So if you say there is, say, for example, edema, there is fluid collection in the abdomen, ascites. These are organic symptoms, pathological symptoms. But if the patient says, I have migraine, I have headache, you cannot see his headache. This is functional symptoms. Or the patient, if the patient says that he has burning in the stomach, this is functional symptoms. Then clinical symptoms, proved symptoms, diagnostic symptoms, pathognomonic symptoms, keynote symptoms, characteristic symptoms. What is keynote symptoms? Again, you see, this is important. So first we'll have to know what do we mean by keynote. Keynote is when there is a concert, concert, the music composed by many organs. You will find that there is a leading instrument, and around which all other instruments are playing. Say maybe this is a flute, this may be a sitar, this may be a, say, behala, violin. And you find the other instruments, they are just going around it, giving some sort of rhythm. So the lead instrument is the keynote. Keynote, it is what note it is giving, this is keynote instrument. So also in totality of symptoms, you will find a single or maybe sometimes two symptoms which are leading all the symptoms of the patient. Say for example, for lycopodium, 4 to 8 aggravation, this is a keynote symptom of lycopodium. Or you can say that radiation of the pain. It is a keynote symptoms of Barberies. You will find most of the symptoms of Barberies, they have radiation or extension of symptoms from one part to another. Or you can say pulsatilla. What is the keynote symptoms? Pulsatilla is very weeping patient, mild patient, and weeps with simple stimulation. Simple problems, he weeps. This easily weeping symptoms is keynote symptoms of pulsatilla. Characteristic symptoms, it is, you see, keynote symptom will be one or two, but characteristic symptoms may be more, maybe half dozen. But these also characterize the case, characterize the patient. Say if it is lycopodium, again 4 to 8 aggravation is a characteristic symptom. Then flatulence after eating in the evening, this is also characteristic symptoms. Then lycopodium patients is afraid in dark or afraid if he is alone. Lycopodium patient is dominating. Lycopodium patient has avarice. So these are characteristic symptoms. So keynote symptoms can be maybe only one or two, but characteristic symptoms may be more, maybe half a dozen. But also these are very important that they characterize the case from other patients. Then eliminating symptoms and determinative symptoms. Eliminating symptoms usually we use in repertory and repertorization. In repertory, we sometimes we select a single symptom, sometimes one or two. And we'll write the symptom first, write the rubric first with all its remedies. And from all other symptoms, we find the rubrics and put the medicine only which are present in the eliminating symptoms. Other medicine we don't write. Say for example, eliminating symptoms, say lachesis, fear of snake. If I find in the patient there is tremendous fear of snake, he cannot think even. So I'll write mind, fear, snake, and I'll write the medicine. Say here, say 10 medicines, 10 remedies are there. Now from this case, I will write other symptoms for repertorization, and in the rubric, I will write only symptoms which are present in fear of snake, not others. So this will make your repertorization and selection very easy and very prompt. So this is called eliminating symptoms. So this belongs to repertorization. Determinative symptom. The symptoms which determines the remedy in the case. This may be again one or more. These are determinative. They will determine the choice of remedy in this case. Then you see negative symptoms, positive symptoms. What is this again? Positive symptoms mean the symptoms which are present in a particular medicine. Say for lachesis, fear of snake, this is a positive symptoms. Again, this may be a negative symptom for lachesis as well. Why? Because while I take a case and I find that most of the symptoms go towards lachesis, but there is no fear of snake. You see? So this is a negative symptoms in this case. And this is important also. I'll hesitate to prescribe lachesis if there is no mention of fear of snake. Or say, for example, say causticum, very sympathetic to other patient. If I find the patient is very cruel, not sympathetic at all to others, I'll be hesitating to select causticum for this patient. So sympathetic here is a negative symptom because the patient does not have these important symptoms of the medicine, which signifies choice of this remedy. So there are, I am not going in detail, there are so many other classification of symptoms and types of symptoms you can find in some good books of classification of symptoms and evaluation of symptoms. Now we come to a very important chapter. This is called evaluation of symptoms. Lokhoner Mullayon. This is evaluation of symptoms. This is very, very important. That's why I'll give you almost whole subject here. So evaluation can be of two types. Evaluation of symptoms can be quantitative and qualitative. So you'll think why it is quantitative, how it is quantitative. Yes, this is quantitative means we know we classified symptoms into various grades and degrees. Grades and degrees are synonymous, same. Kent said grade and Herring said degree, but it's the same thing. So we say that aggravation in a closed warm room is a first grade symptom of pulsatilla, or fear of snake is a first grade symptom of lichen, not lichen, lichen is second grade. Again, we say that aversion to sweet is a second grade symptom of causticum. We say like this. Or itching in the head is a third grade symptom of lycopodium. So we say like you use this grade, and in repertory you find this gradation. Which one is first grade medicine? This comes in bold type of letters, bold type letter. The second grade comes in italic. Third grade comes normal Roman type of letter, normal letter. So this is quantitative because this is classified according to grades. How many grades? That's why it becomes quantitative. So this is called quantitative evaluation by grades or degrees. Now again, you see, this evaluation has some problem for us because Kent classified 3 grades. Kent classified all the symptoms into 3 grades: first grade, second grade, third grade. Herring classified into 4 grades. Again, von Bonninguschen classified into 5 grades. So sometimes in repertorization, particularly from multiple repertory, you may get confused that which grade I'll put, because if first grade medicine you will put 3, number 3, second grade medicine 2, third grade medicine number 1. So first let us see what we mean by first grade symptom. What do we mean by second grade symptom? What do we mean by third grade symptom? As I said, that fear of snake is a first grade symptom of lichen. It means you can see I put it here. You can see afterwards from my lecture, from the record of my lecture. A symptom will be first grade if it satisfies these 3 things. That this symptom must have been produced by most probers in approving. So this medicine, say for example, this lichen was proved by 100 provers. Then here most means say about 70 to 80 provers developed these symptoms. That he was afraid of snake. Or if it is pulsatilla, say for example, that he was worse in a closed warm room. So this symptom must have been produced by most probers, number one. Number two, this symptom must have been confirmed in the reprovings, because we know that these medicines were proved by Hahnemann himself, then his students, then after their death, many of second, third generation homeopaths in America, in Europe. So these were reproved. They proved new medicine at the same time. They reproved what Hahnemann has already proved. So that symptom must be confirmed in reprovings also. And third thing, that this symptom must be verified extensively on sick. What do you mean? It means that some doctors, some homeopaths, he used this symptom selecting this medicine, and the patient was cured. So this symptom became verified clinically. So if a symptom satisfies these three characters, that it must have been produced by most probers, it was confirmed in reprovings, and it was verified extensively on the sick, this is first grade symptom of this particular medicine, particular remedy. Now let us see what is second grade symptoms. Second grade symptom, I wrote it here, you can just see that symptom must have been produced by some probers. If there are 100 probers, this symptom was produced by, say, 25 probers or 20 probers. And this symptom also was confirmed in the reprovings. While there were reprovings of that medicine, this symptom came in some probers. And number three, it should be verified occasionally on the sick, not very extensively, but at least some of the practitioners should have reported that they used this symptom and they selected this medicine on the basis of this symptom, and the patient get cured. So these three characters signifies that this symptom is a second grade symptoms. So for, as I said, that Costigan is very averse to sweet. So that symptom was produced by some probers. It was confirmed in reprovings, and it was verified occasionally on the sick. Then it becomes second grade symptoms. Now let us come to the third grade symptoms. Third grade symptoms means this symptom must have been produced by at least one or two, or you can say one or few, 1, 2, or 3 probers. But that was neither confirmed in reprovings. In reprovings, it was not there. Also, it was not verified on sick. Then you will say, why did you put this symptom under this medicine? Yes, because this have been proved on few probers. But maybe later on, if this is proved on many other probers, this will be produced. And then this will be promoted from third grade to second grade. That's why any symptom which was proved by a prover, you cannot just discard. So they put it under this medicine. So this symptom was produced by 1 or 2 provers, or maybe 3 provers. But it was not confirmed in reprovings, nor verified on the sick. It was not still verified. But this may be verified afterwards by some other homeopathic practitioners. And also clinical symptoms. The symptoms which did not come in proving, but that was proved clinically, they belong to third grade symptom. So I hope our homeopathic brethren who before did not know this classification, I hope that you understand now. Okay, now We finished quantitative evaluation of symptoms. Now we'll switch over to qualitative evaluation. Quantitative evaluation, সংখ্যাবাচক মূল্যায়ন. Qualitative evaluation, গুণবাচক মূল্যায়ন. So what is গুণবাচক or qualitative evaluation? Let us see. So this is qualitative evaluation. So we said that there are grades of symptoms, degrees of symptoms in quantitative. In quantitative evaluation, we discuss about grades and degrees. Grades by Kants and degrees by Herrings. Okay. Now there is another thing. This is called ranks of symptoms. What does it mean? You see, this evaluation of symptoms it is not so easy in homeopathic literature. You will find many authors evaluated differently in his own way. But we here put the consensus of most authors about the evaluation. So we say ranks of symptoms. This is different than grades. So ranks means ranks, you see. We say in military, he is a general, this guy is a colonel, and that guy is a captain. So you see their ranks. So general is highest ranking, say colonel is medium ranking, lieutenant or captain is lower ranking. So this is called rank. Or in a college, there is principal, there is professor, associate professor, assistant professor, senior lecturer like this. These are ranks. In secretariat, you find there is senior secretary, there is secretary, additional secretary, joint secretary, deputy secretary, senior assistant secretary, then assistant secretary. So these are ranks. This is called hierarchical rank. Hierarchical. Kromobinnas. So in symptoms also we find there are ranks. You will say how? So let us see how. So you see, we can classify symptoms into general and particular. As Kant and did. General, particular, then common, uncommon. Okay. So in general, there is mental general, there is physical general. And we know that general symptom has more value or higher rank than particular. General has higher rank than particular symptoms. Again, general has two sub-ranks, you see, mental general and physical general. So mental general has higher rank than physical general, you see. Then again in mental general, there are three sub-rank. One is called will symptom, will or emotion, say fear, anxiety. These are belonging to will or emotions. Then intellect, say for example, delusion, illusion, mistake, confusion. They belong to intellect group of symptoms. Then memory, say memory is active, memory weak, there is forgetfulness. These are symptoms belonging to memory. Now in homeopathic ranking, will symptoms are of highest rank. Then intellect lower than will, then memory also lower than intellect. So you see, even in this category there are also hierarchy. This is a hierarchy. Means kromobinnas, from one layer to another, then another, then another. This is the hierarchy. So even mental symptom has, you see, sub-ranks: will, intellect, and memory. Then only physical general. Physical general is lower than memory. Memory is lowest in mental. But even this is of higher rank than physical general. What is physical general? Say thermal sensitivity. Patient is shit kator, gorom kator, we say. Is cold sensitive or heat sensitive. This is physical general. He likes bathing or not. He is averse to bathing. These are physical general. Thirst. He has no thirst, thirstless, or he has unquenchable thirst. He has no appetite at all, or he is a very voracious appetite. Desire and aversion to some foods. He is very much fond of sweet. He is averse to, say, salt. These are general symptoms. Then sleep and dream, sex. So these are physical general symptoms. So this has one rank, not like mental, 3 sub-rank. Then lower than this, there is particular symptoms, particular or regional or organic symptoms from head to foot, from head, throat, stomach, rectum, bladder, genitalia, extremity, skin. These are all particular symptoms. So they belong to lowest rank. So you see they are ranking in homeopathic symptomatology. Highest rank is will of mental general. Second, intellect of mental general. Third, memory of mental general. Fourth, physical general. Fifth, particular symptoms. Again, you see, among all the symptoms, there are also further divisions. Say in will, uncommon and common. What is uncommon? Say, for example, as I said, if a person is very much afraid of cockroach, this is an uncommon symptom. Again, common symptom. You find that a mother, she is very much depressed because her son died. She lost her son. This is a common symptom. A mother, of course, a mother will grieve for the loss of her son. This is a common symptom. But this will be uncommon if this mother does not like her son. She says that let this son die. I don't want him. This is uncommon. So even will symptom, you see there is uncommon and common. So if it is uncommon, yes, this is a higher rank. Common, lower rank. Again, this says first grade, second grade, third grade. The symptom may be first grade, second grade, third grade. If first grade, this has higher rank. Third grade, low rank. So in this way, you can classify intellect, you can classify memory. Then come to physical general. Physical general also, they have uncommon and common. What is uncommon? A guy says that he is averse to bathing in winter. Is irregular in bathing in winter. This is common. Yes. Many general people will be little bit averse to bathing every day in hot winter. But if you find a guy who is averse to bathing even in summer, he takes bath only twice in a week in summer. Yes, this is uncommon. This is uncommon. So again, you see, if somebody says he is very much fond of taking sweet, he likes sweet very much. This is common. Sweet, many people like sweet. But if some says sweet, he does not like sweet, this is a little bit uncommon. Because sweet, most of the people like. Less people only do not like. So in this way you find there is commonness and uncommonness. Again, this symptom can be first grade, second grade, third grade. So there will be difference in ranking. In particular symptom also the same thing. They have uncommon symptom and common symptom. If a person says that he has headache, and headache gets better going to sunlight or giving heat or warm application to his head, this is uncommon. Headache, this is common. If you have headache, it will be worse if you give him heat application. But if the patient says that for his headache, he likes heat application. This is uncommon. So you can find many things. Say one patient will say he has, for example, in the stomach, he has pain in the stomach. He has duodenal ulcer and he has pain in the stomach. And the stomach pain of his gastritis gets worse when it is empty, before eating, when he is hungry, and gets better after eating. This is a common symptom, because most of the gastric ulcer patient, duodenal ulcer patient, you will find the pain is worse before eating in empty stomach, and it is better by eating. So this is common symptom. But this will be uncommon if he says that the reverse one, he is worse after eating, or he is better by eating something particular, some specific things. Why? He will say, I get better only by taking ice water, or maybe milk, or maybe warm milk. So this will be uncommon again. So you find in the particular symptom even there is common symptom and uncommon symptoms. And this symptom again has first grade, second grade, and third grade. First grade will be higher, third grade will be lower. So this is called ranking of symptoms of homeopathic system of medicine. Now, when I teach this evaluation to some students, at the end of my teaching, I ask them some question. I ask them, tell me, what is the highest ranking symptoms and which one is the lowest ranking symptoms? This is a question. I think most of you can answer. But let me say, the most highest ranking symptoms will be first grade uncommon will mental symptoms. This will be highest. First grade uncommon will symptoms of mind. This will be highest rank. And the lowest will be third grade common particular symptoms. Third grade common particular symptom. If you understand this thing, it means you understood the ranking of symptoms, what I said now, qualitative evaluation. Okay, I hope we can go further. Now, totality of symptoms and total number of symptoms. This is again a good thing. Dr. Samuel Hahnemann, in his Organon, discussed about totality of symptoms in aphorisms 6, 7, and 8. So let us see what does it mean. This is very important, because he said totality of symptom is the outward expression of inner disease. সিতু আমি একটা লেকচার নিতেছি রে অনলাইনে, পরে ফোন দেবো না, কালকে 4:30 থেকে 8:30. Okay. So this is very important. And if he says, if you can remove the totality of symptoms by your treatment, there will be no disease left either outside or inside the body. So this is very important. And there is another term, total number of symptoms, totality of symptoms and total number of symptoms. We'll have to understand the difference between this. Okay. Now, totality of symptoms mean not only symptoms and signs, because signs are also symptoms in homeopathy. We say subjective symptoms, objective symptoms. So, objective symptoms are signs. So, totality of symptoms, what Hahnemann says, let us see. He says that unprejudiced physician sees in a case of disease only the disturbance of the body and soul, which are perceptible to the senses. That the physician will see only the disturbance or the painful experiences in the patient, in his body and soul, which he can perceive, which he can understand. These are subjective symptoms, objective symptoms, he says here, you see, subjective symptom, also objective symptom, and incidental symptoms. That is deviation from the former healthy condition, which the patient personally feels. Patient around him will notice, and physician sees in him. Patient what feels, what the other people around him they notice, and what physician sees. So totality of these symptoms and signs represent the entire extent of the sickness, and together they constitute its true and only conceivable form. So you see. So it seems total number of symptoms. No, we'll discuss afterwards. So the what patient feels, other patient looks, and physician sees, all these symptoms, but you see that here represents the entire extent of the sickness. These symptoms must represent the sickness. The picture of sickness will be reflected in these symptoms. Then only they will constitute its true and only conceivable form. So Hahnemann says again, it is the totality of symptoms, and he says that outer image expressing the inner essence of the disease. So what is totality of symptom? This is the outer image of the inner disease. That is of the disturbed vital force. This must be the main, even the only means by which disease allows us to find the necessary remedy. The only one that can decide the appropriate choice. So our simile imam can be selected only from this totality of symptoms, not from other imagination or your knowledge about the patient or disease. No, only what the patient is giving you as symptoms, maybe symptoms and signs. Let us discuss a little bit more. Then Hahnemann again he says, briefly in each individual case of disease, this totality of symptom must be physician's principal concern, the only object of his attention, the only thing to be removed by his treatment in order to cure. So he said the physician only consider this totality of symptom for selecting medicine, nothing else. Again he says, removal of totality means cure. If by your treatment you can remove the totality of symptoms, yes, the patient is free of his all disturbance, all disease. After elimination of all the symptoms and perceptible signs of disease, you see, not only symptoms, he said perceptible signs of disease. One cannot imagine or demonstrate by any experiment in the world that anything but health remains. Nor can one doubt that all the pathological changes inside the organism have been neutralized. It means when the totality of symptom has been removed, it means you have removed all essence of the disease from the patient. Now, one professor of homeopathy is okay, he's a professor in an Indian homeopathic college. He's actually assistant professor, but I find some people who are assistant professor, they write professor so and so, but that should not be. In our country, professor will write only he is full professor. Then you can write, yes, professor so and so. But if you are assistant professor, you should not write that you are professor so and so. But this guy here writes he is professor everywhere. And he said, I was a little bit astonished that someone said that he treated a patient of cholelithiasis, gallbladder stone, and after his medication, the patient did not have any pain, no vomiting, no flatulence. And he claimed that the patient has been cured. Okay. Now that professor is a good one. He said he does not believe that removal of symptoms means removal of disease. This thing, what Hahnemann said. Removal of totality of symptoms means removal of all disease. He does not believe. So I did not interfere, but I want to say that I doubt that he has confusion about knowing totality of symptoms. You see, if it is a case of gallbladder stone, this guy, so even the stone itself is a part of totality of symptoms. Because Hahnemann here said, symptoms and signs, what the patient, what the physician sees. Now physician can see by ultrasonography, by endoscopy. These are also signs. So you will have to include even signs into your totality. You'll have to consider. So when you declare that patient has been cured, it means not only from the symptoms, but also the pathological signs. If you say that this gallbladder stone patient has been cured, by ultrasonography also you must see that there is no stone. If you say that you have cured a case of chronic CKD, chronic kidney disease, also you must find that not only his edema and some anemia you removed, or his say urine became okay, but also you'll have to find that his creatinine, serum creatinine is normal, his EGFR became normal. Then only you can say that you have removed the totality of symptoms and the patient is cured. So we'll have to keep in mind that if I say that this patient has been cured, so before I say it is cured, I'll have to confirm that it includes not only symptoms, also the internal change. And once the internal change and symptoms removed, you should not have no doubt that patient is still ill. You should not have doubt. Then Hahnemann said, say the wrong. Now, before going to total list of symptoms and total number of symptoms, we'll have to say something else, something more. This totality of symptoms, you see, this is different than total number of symptoms. What is total number of symptoms? Total number of symptoms, say I have a patient of, say for example, say IBS, irritable bowel syndrome. So many patients come to us. He has flatulence, he has diarrhea, he has alternate constipation and diarrhea, and he cannot digest any food. So many things. So I took a history from him by 2 hours and I recorded, say, about 80 symptoms from his alimentary system, from his urinary system, all about mental and general. These 80 symptoms, this total 80 symptoms, which I collected from the patient by taking the history, is the total number of symptoms. So should we say, or should we think that Hahnemann meant? No. Hahnemann said this totality of symptoms must represent a disease picture, must represent the inner essence of the disease, and it must direct to some picture of remedy, that by following the symptoms it indicates some medicines. You have taken a history haphazardly and it does not give any group of symptoms representing any picture of any medicine. Then this is not totality. This is again total number of symptoms. So what is totality again? I say I am Sheikh Farooq Alahi. Okay. So if I have been dissected, say I have been dissected into 20 parts of body. they cut me like this, like this, like this. There are 20 parts, okay? All these 20 parts you put in a box, in a bag, and put it in front of you, and you say, you tell me who is this guy? You cannot say. Why? You see, all the parts are there, still you cannot say. So this is total number of symptoms. There are all parts, but you cannot say this is this particular guy, this person. When you will say that, yes, I know, yes, it seems that this is the body of so and so. When these symptoms will be arranged in a schema, in a meaningful order or design, that you put the head first, then you put the neck, then you put the chest, then you put the abdomen, then you put the leg. Now, yes, this guy looks like that guy. Say Farooq Ali or somebody. So what does it mean? It means that this part should be arranged in a meaningful design or schema. Then only it will represent the whole picture or essence of the disease, and by this you can find the picture of similar remedies from which you can select. But if you don't arrange these symptoms in design just haphazardly, then it becomes only total number of symptoms. Again, let me give you another example. Nowadays in the car, there is no carburetor. This is, I think, automatic carburetor. But maybe before 30 or 40 years, when I had my car, so there were carburetors. And then carburetor had, believe, I forget now, 23 parts, small parts. And when a carburetor is out of order, the mechanic will move the carburetor, and he will say, repair all these things. Then he will put all the parts of the carburetor in the specific design. Which one on the right should be right, which one on the left should be left, which one above, below. And then he will fit this carburetor in the car. And now when you switch the engine, yes, this will start. So the parts of the carburetor must be arranged in a specific design or schema. Then only it will work. So your symptoms, 22 symptoms, should be arranged in such a way that it represents a picture of essence of the disease as well as the picture of some medicines. You can say, yes, this looks like lycopodium. Yes, this looks like this or that. So how can we make the totality of symptoms? You see, Dr. Ken said you can make totality of symptoms only by 4 symptoms, and may not be by 100 symptoms. For example, if you give a small child, okay, you draw Rabindranath Tagore, and you give him so many, brush and so much ink. Okay, you use all this brush and all the ink, and one day for you draw Rabindranath Tagore. You'll find that he draws something, but it does not represent or mean Rabindranath Tagore. But if you give an artist, our Ronobi, that you draw Rabindranath Tagore, maximum maybe he will put 4 marks, 4 lines, and you will see he is Rabindranath Tagore. For Mohandas Kamar Chand Gandhi, MK Gandhi, he will take, say, 3 or 4 drawing lines, and you will see this is Gandhi. This is Rabindranath Tagore. Why? This guy, by 4 lines only, represented Rabindranath Tagore so nicely, and this boy, he could not do it by drawing whole the day, by so much this brush and ink, because this artist, he knows what are the peculiarities in the feature of Rabindranath Tagore, what is the peculiarity in the feature of Mohandas Kamar Chand Gandhi. So he put this thing only, and this represents the whole person. So one guy brought to Dr. J.T. Kent a history of a patient written in 10 pages. And he's asked Dr. Ken that please repertorize this case history. Then Ken the 10 pages. Then he put his pen only on 4 symptoms. And he said this patient is Costicam. This patient needs Costicam. Then this guy said, how is that? I wrote all these symptoms, 10 pages of symptoms. You took only these 4? And you said this is Costicam? Then what Ken said, these 4 symptoms are symptoms of the patient. And all symptoms you wrote, these are symptoms of disease. And you should select your medicine by symptoms of patient, not by the symptoms of disease. That's why you can draw a totality of symptoms only by 5 symptoms. And another one, he will write about 50 symptoms and there will be no totality because there is no picture, no arrangement, no essence of disease picturized in the totality. That's why when we write the history, we'll have to keep in our mind that we are taking the peculiar mental symptoms of the patient. We are taking the general symptoms of the patient, and we are taking the particular symptom of the patient with modalities and causation if possible. So if you write a patient has, say, he has chronic duodenal ulcer, patient came to you and he says, I have much flatulence in the stomach, in the abdomen. Anytime I take food, there is flatulence, there is bloating. And you ask him when it is worse, he says in the evening. And you ask him when there is bloating, what about your pain? He said, I make it loose, I loosen it. Okay. Then he took from his general symptoms, he found that he is little bit warm. Then he found that because he has bloating, so he can take only little food, then he becomes, there is satiety. He becomes full after only taking little food. Then in his desire, he found he's very much fond of taking sweet and warm food. And if he found he's very much forgetful, he's afraid in dark, he's a coward guy, but at home he's very dominating. And he finds that he's very miser. So with all this, you see 6-7 symptoms. You included peculiar mental symptoms. You included peculiar general symptoms. You included peculiar particular symptom. This thing you arranged in such a way that because there is particular, there is general, there is mental, that this can represent a picture of medicine along with a picture of essence of the symptoms inside. So this is the totality of symptoms, if I can say you as I understand. This is the totality of symptoms, not necessarily consist of 60-70 symptoms. It may be of 5, 7, 10 symptoms only. But this must represent a picture, or it must picturize the essence of the patient, the important symptoms of the patient, so that you can find in this picture an image of some remedies so that you can choose from this. Otherwise, you did not give me a totality. You gave me only total number of symptoms. So this is the last thing you write, you see. Unless these symptoms are arranged in a meaningful order, schema or design, they will not give any therapeutic indication to select a remedy. So I hope this is a good subject, and this is very important to know what is totality of symptoms and how to make it. When we take the history, we must have in our mind that we have formed a totality from this history taking. Otherwise, this will have no meaning in selection of medicine. And how can you make the totality of symptoms? It will have to include peculiar, some general symptoms, some peculiar peculiar mental symptoms, peculiar general, and peculiar particular with modalities. Then you can find that this will picturize an image of some medicine. And also, this is the essence of the inner disease of this patient. And this will help us in our selection of medicine and in the treatment of the patient. I think we can finish today because this is already a long lecture. Next day, this is very important, we'll go how to select homeopathic remedies, the other things. And we can also discuss how to select homeopathic remedy without repertory and how can we select medicine with repertory and how to repertorize, just a brief description. Then we'll go selection of potency and dose, diet and regimen. Then we'll go to follow-up. In follow-up, we'll discuss Kent's 12 observation and Vitolka's 22 observation and Herring's law of cure. And then we'll finish this long series of lecture. So I think this was today. Thank you all very much for patient listening. And if you have any query, yes, you are welcome to put your question or your comment. Dr. Anwar Patwari, I'm giving you the microphone. You can conduct this question and query. Thank you.
Thank you very much, sir, for your excellent presentation. Anybody have any question? You can raise your hand. Then I will announce your name. কারো কোনো প্রশ্ন বা মন্তব্য থাকলে আপনারা হ্যান্ড রাইজ করলে আমরা নামগুলো ঘোষণা করব। আপনার প্রশ্ন বা মন্তব্যের জন্য শিলা রানী কর্মকার হ্যান্ড রাইজ করেছেন, আপনার মাইকটি আনমিউট করে প্রশ্ন করবেন।
Thank you, sir, for giving me a chance to tell something about the excellent class of Dr. Farooq Elahi, sir. Sir, at first I want to give you my thanks and regards and adab, sir. Sir, you have provided us a very wonderful class and elaborate discussion about the classification of symptoms, the evaluation of symptoms, the totality and total symptoms, and how can we differ the totality and total symptoms. So we are very lucky that you give us the whole time and a very vast discussion and very critical things. What should we not think generally, but you make to us very simple to understand. Thank you, sir. My cordial thanks to you, sir. I came to know the clear concept, the highest rank and the lowest rank. How should we think about the highest rank, choose the highest rank of symptoms? So it is very clear to me that the first grade uncommon mental will symptoms is the highest rank. It's very clear to me. And how we select the lowest rank, it should the third grade particular or regional symptoms, common symptoms.
Yes.
So it's very very interesting subject, interesting things that you make understand to us. In generally, we are very difficult. We face many difficulties to understand the lecture, but you make this lecture very simple to us, sir. I cordially thanks to you again, sir. And the symptoms of patients and symptoms of disease, it's also very difficult things to understand to our young practitioners. Sir, keep your lectures as you provide us so elaborate and so discussive. Sir, again, I
Okay, thank you.
give you thanks. And yes, sir.
Thank you.
ডক্টর মৃণাল কান্তি দে স্যার, আপনার মাইকটি আনমিউট করে প্রশ্ন বা মন্তব্যটি করবেন প্লিজ। ডক্টর মৃদুল কান্তি দে স্যার, স্যার আপনার মাইকটি, হ্যাঁ।
Many thanks to our lecturer and our president of the organization, Sheikh Farooq Elahi. আজকের আলোচনাটা খুবই সুন্দর লাগছে, অনেক মধুর, এবং আমার মনে হয় প্রতিটি চিকিৎসকের জন্য, বিশেষ করে যারা এই বিষয়গুলোতে একটা মানে কমপ্লিকেশন বুক করছিল দীর্ঘদিন ধরে, আমার মনে হয় এই লেকচার গুলো শোনার পরে হয়তো অনেক ভালো বোধ করবেন। আমি স্যারকে অনেক ধন্যবাদ জানাচ্ছি। আমি একটা রিকোয়েস্ট করব, আসলে যেহেতু বাংলাদেশ এবং একবার আমরা সংগ্রাম করেছি দেশের জন্য অনেক কিছু, সেই ভাষার জন্য থেকে আরম্ভ করে অনেক কিছু, তো স্যারকে বলবো এর সাথে সাথে একটুখানি বাংলা বলা যায় কিনা এটা একটু ভেবে দেখার জন্য। তাতে করে সুবিধা হবে। ইংলিশ বলাতে হয়তো আমাদের দেশে বিদেশে যে সুনামটা স্যার অর্জন করেছেন, একই সাথে আমার মনে হয় আমাদের দেশের দিকে তাকালেও ম্যাক্সিমাম ডক্টর যারা আছেন তারাও বোধহয় এই সকল বিষয়ে কেউ জেনে থাকলেও তারপরও আমার মনে হয় জানাটা শেষ হবে না, এবং তারা আরো ভালোভাবে শিখতে পারবেন, জানতে পারবেন, অত্যন্ত দৃঢ় মানে মানসিকতার পরিচয় দিতে পারবেন। এই বিষয়ে আমি স্যারকে এই অনুরোধ রেখে আমি অনেক ধন্যবাদ জানিয়ে আমার বক্তব্য শেষ করলাম।
জি, ধন্যবাদ আপনাকে। আমরা তো অ্যাকচুয়ালি আমাদের এই পুরা 3.5 বছরই তো তাই করে আসছি। আমরা প্রথমে ইংলিশ লেকচারটা দেই, তারপর তার বাংলা ভার্সন দিই। ইংলিশ লেকচারটা দেই কারণ আমাদের দেশে ধরেন অনেক আছে কিন্তু তারা ইংলিশ হোমিওপ্যাথি চর্চা করেন, এবং ইটস গুড, বিকজ আপনি বাংলা ভাষা তো সব বই পাবেন না, ইংলিশে যত বই আছে বাংলা ভাষা সবটা ট্রান্সলেশন পাবেন না, বা রেপার্টরি করা, প্র্যাকটিস মেডিসিন শেখা, এগুলা ইংলিশ ভাষায় সাধারণত করা হয়। আবার আমাদের এই লেকচারে আমরা বিদেশি বন্ধুরাও থাকেন মাঝে মাঝে, এই জন্য আমরা একটা ফোরাম ক্রিয়েট করতে চাচ্ছি যেখানে ইংলিশ যারা লার্নার বা ইংলিশ স্পিকিং কান্ট্রি থেকে ইংলিশ স্পিকিং হোমিওপ্যাথ যারা, তারাও যাতে আমাদের বক্তব্যগুলো তারা অনুধাবন করতে পারে, শুনতে পারে, এবং তারাও আমাদের সাথে শেয়ার করতে পারে। আর একই সাথে আমরা বাংলা দিই এই কারণে যে এই জিনিস অবশ্যই যারা আমাদের বাংলা ভাষী বা যারা ইংরেজিতে কিছুটা দুর্বল, তারা যাতে সহজে এই জিনিসটা একই জিনিস বুঝতে পারেন, এই জন্য পরবর্তীতে আমরা বাংলাতে দিই। এটা আমাদের নর্মাল প্র্যাকটিস। থ্যাংক ইউ।
ওয়েলকাম।
ধন্যবাদ স্যার। আমার মনে হয় স্যার আজকে আর যদি কারো কোনো প্রশ্ন বা মন্তব্য না থাকে, আর কারো হ্যান্ড রেজ করা নেই, তাহলে স্যার কোনো অ্যানাউন্সমেন্ট থাকলে একটু হ্যান্ড রেজ করেছেন দীপ সরকার, এক্সকিউজ মি প্লিজ, জিএম জিয়াউর রহমান, আপনাকে পরে দিচ্ছি। দীপ সরকার আপনার হ্যান্ড রেজ করেছেন, মাইকটি আনমিউট করে প্রশ্ন বা মন্তব্যটি করবেন প্লিজ।
আমাকে শোনা যাচ্ছে?
জি জি শুনতে পাচ্ছি, আপনি বলুন প্লিজ।
At the end, you have said that in the totality of symptoms, a artist can sum up the whole patient picture with 4 indicative symptoms, which was particular with modalities, if possible, the causation, peculiar mental symptoms, peculiar general symptoms, and I missed the 4th one. So what was that? Thank you, sir.
Again, I couldn't follow you. What? Hello.
At the end of the lecture, you have said the totality of symptoms can be described within the 4 symptoms. You have said that was the peculiar general symptoms, peculiar mental symptoms, particular symptoms with modalities, if possible with causation, and I
Yes.
want to know the 4th one.
4th one?
Maybe I have, yeah.
No, not 4th, because we classified the symptoms into mental, general, and particular. Of course, causational comes, So I emphasize that you will have to write the symptoms in the totality, that it should be peculiar, it should be uncommon, so that it can represent this patient only. And you can find a particular medicinal picture out of this. So if the symptoms are common, you don't find this picture. If you find a patient has peculiar mental symptom, the patient is afraid of snake, patient cannot tolerate any constriction in the neck, patient is very much talkative, patient has burning in the feet, patient cannot tolerate sun heat, as a patient has loquacity, something like this. And if maybe this patient has, say, if there is a anal fissure, the peculiar symptom he will have that there is long-lasting pain ameliorated by warm water, warm bath. So this is peculiar. He has pain in the anus ameliorated by warm water, and this is long-lasting. This also belongs to legacies. So you will have to write the peculiar thing so that this will signify a picture of medicine, what you can select for this particular patient. So in the totality, you will have to have peculiar mental means uncommon mental, then peculiar general and peculiar particular symptoms. This I emphasize that in your totality, it must have these three components. Then this is a totality, and you can utilize this one to find a medicine. Thank you.
জিএম জিয়াউর রহমান, আপনার মাইকটা আনমিউট করে আপনার প্রশ্ন।
Thank you so much, sir. Basically, I'm very new and learning the homeopathy. So today's lecture was very excellent, and I'd like to thank to sir. Basically, I have nothing to comment, and I have no question as well. I would like to know that, sir, why are you practicing basically? What is your chamber? Is it in Dhaka or outside?
I practice in Dhaka since long time, more than 25 years. This is in Kakrail, 73 Kakrail, Dhaka.
Okay, thank you. 73 Kakrail, Dhaka. Okay, thank you so much, sir. We have some patients we find in our family or the relatives, so we can recommend to you as well. So thank you so much, sir.
Okay, welcome. Dr. Patwari.
সময় নেই, যদি আপনি চান কোনো ঘোষণা যদি আমাদের থাকে সংগঠনের পক্ষ থেকে, তাহলে সেটা দিয়ে আমরা শেষ করবো আজকের মতো।
আমরা একটা ঘোষণা দিচ্ছি। আমরা বলছিলাম যে আমরা 2টা পেড ক্লাস নিব, ক্লাস উইথ পেমেন্ট, but this payment will go totally to our organization, Bangladesh Homeopathic Parishad. The lecturer like me and the conductor who will conduct, Dr. Anwar Patwari, will not take any money. All money will go to our organization fund. So the class will be of clinical examinations. As I said before, that we find, আমি বাংলাতেই বলছি যাতে সবাই বুঝেন, আমরা দেখেছি যে আমাদের হোমিওপ্যাথিক চিকিৎসকরা হোমিওপ্যাথিক কলেজে ক্লিনিক্যাল এক্সামিনেশন প্রায়ই শিখতে পারেন না, এটা ভালো করে শেখানোর লোক নেই, এবং তারা না শিখেই পাশ করে বের হন, এবং আলটিমেটলি পেশেন্টে এইসব ক্লিনিক্যাল এক্সামিনেশন তারা করতে পারেন না। একটা লোকের যদি টনসিল দেখতে হয় কি করে তারা জানেন না, বা অনেকে দেখা যায় যে নাকের মাঝে পলিপ আছে না, এইচসিটি আছে এটা বুঝেন না, কানটা পরীক্ষা করতে জানেন না, বা স্টেথোস্কোপ দিয়ে বুকে কি করে পরীক্ষা করতে হয়, কি দেখতে হয় তাও জানেন না, আপনার একটা রোগীর লিভার বড় হয়েছে কিনা এটা তিনি বুঝতে পারেন না, একটা মনে করেন সে কনজেনিটাল হার্ট ডিজিজের বাচ্চা আসছে, জাস্ট এতটা লাগিয়ে বোঝা এটাও বুঝতে পারেন না। তো এর লোকটার কি অ্যানিমিয়া আছে জন্ডিস আছে, কোথায় দেখতে এনিমিয়া, কোথায় দেখতে জন্ডিস, তার টেম্পারেচার। আমি লাস্ট দিন বলছিলাম যে একটা ছোট বাচ্চা 3 মাসের বাচ্চা এর টেম্পারেচার কোথায় দেখবেন, আর আমার মতো বৃদ্ধ আমার টেম্পারেচার কোথায় দেখবেন, এটা কিন্তু শিখতে হয়। এটা হলো ক্লিনিক্যাল এক্সামিনেশন, এটা শিখতে হয়। তো যারা আমরা ভেবেছি যে আমাদের কলিগরা যারা জানেন না বা শিখতে পারেননি সামহাউ, আমরা তাদেরকে একটা চান্স দিব যে ইউ লার্ন ইট এগেইন। এবং এটা শেখার জায়গা খুব কম, আমাদের কাছে আপনি শিখতে পারবেন। আমরা ভালো বুঝি এই সাবজেক্ট, এবং মানে হোমিওপ্যাথিক দৃষ্টিভঙ্গিতে এই জিনিসগুলো আমরা শিখাবো। তো এই ক্লাসটা ধরেন অন্তত 15 থেকে 20টা ক্লাস হবে প্রতি বুধবারে। এই যে বুধবারে 9:30 থেকে 11টা ধরেন। এই ক্লাসে আমরা পরিষদে বলছেন যে পরিষদের কমিটি, সেন্ট্রাল কমিটি সিদ্ধান্ত নেবে। পরিষদের সেন্ট্রাল কমিটি এই গত শুক্রবারে মিটিং করে সিদ্ধান্ত নিয়েছে যে এটা শীঘ্রই আমরা চালু করব, এবং আপনাদেরকে অগ্রিম বলে দিচ্ছি এটার জন্য একটা ফি নির্ধারণ করা হয়েছে পার ক্লাস। যারা পরিষদের সদস্য তাদের জন্য 100 টাকা, আর যারা পরিষদের সদস্য না তাদের জন্য 150 টাকা, আর যারা দেশের বাইরে থেকে যোগ দেবেন বিদেশি তাদের জন্য 200 টাকা। আমরা আগে ক্লিনিক্যাল এক্সামিনেশনটা শেষ করব, এটা শেষ করার পর আমরা আরেকটা ক্লাস শুরু করব, সেটা হচ্ছে রেপার্টরি এন্ড রেপার্টরাইজেশন। আমরা জানি রেপার্টরি অনেকেই জানেন, আবার অনেকে জানেন না, অনেকেই শিখানো বটে। কিন্তু আমার মনে হয় যে আমরা রেপার্টরি শিখেছি খুব বড় বড় জ্ঞানী লোকদের কাছ থেকে, বড় বড় স্টালওয়ার্ডদের কাছ থেকে, এবং রেপার্টরি শেখানোর বেশ ভালো কিছু কায়দা কানুন আমরা জানি, খুব সহজেই শেখাতে পারি আমরা, মানে দীর্ঘদিন শিখিয়েছি অনেককে। এই জন্য ওই রেপার্টরি ক্লাসগুলো আমরা নেব, রেপার্টরি এন্ড রেপার্টরাইজেশন। সেটাও হয়তো ধরেন অন্তত 15টা ক্লাসের মতো হবে, ওইটাও ওইভাবে পেইড হবে। তো আমরা শিগগিরই এই ব্যাপারে আপনাদেরকে ঘোষণা দিয়ে জানাবো। আমি জাস্ট অগ্রিম বলে রাখলাম এটা। যারা যারা ইন্টারেস্টেড, যারা মনে করেন ক্লিনিক্যাল এক্সামিনেশন জানেন, তাদের জন্য ক্লাসের দরকার নাই। আর যারা মনে করেন জানেন না, দিস ইজ ইউর বেস্ট চান্স এবং মেবি লাস্ট চান্স। কারণ এরপরে এই ক্লাস আমি হয়তো আর নেব না, আমি এনাফ বিজি। তো আমি ভাবছি অনেকের চাপে ক্লাসটা নেব আমি। এটা শেখার একটা খুব ভালো সুযোগ পাবেন। ওই যে বললাম অনেকেই জানেন না টেম্পারেচার কিভাবে দেখে। বগলে যদি আপনি থার্মোমিটার দিলেন, টেম্পারেচার যা দিল এর থেকে কত মাইনাস করবেন রিয়েল টেম্পারেচার জানার জন্য। ছোট বাচ্চার কিভাবে মাপবেন তাও জানেন না। একটা পালস কিভাবে দেখতে হয়, একদম 90% হোমিওপ্যাথ জানেন না। হোমিওপ্যাথ স্টুডেন্ট আমি যাদের আমি 9 বছর বিএইচএমএস এর পরীক্ষক ছিলাম, এক্সটার্নাল এক্সামিনার, ডিএইচএমএস এর ছিলাম। এই জন্য আমি স্টুডেন্টদের পালসটা, মানে স্টুডেন্টরা কেমন করে আমার মোটামুটি একটা আইডিয়া আছে। এই আইডিয়া থেকে আমি দেখি যে সিম্পল পালসটাও জানে না অনেকে, অথবা পালস না জানলে আমরা তো ডাক্তারও বলতে চাই না। এই জন্য এই জিনিসগুলো কিন্তু কলেজ থেকে শিখে আসেনি কেউ, প্রায় দেখি আমরা কলেজ থেকে শিখায় না কেউ, অথচ এগুলো দরকার। আপনি চাকরি পাচ্ছেন উপজেলা হেলথ কমপ্লেক্সে, এই যে আমাদের হোমিওপ্যাথিক ডাক্তাররা সরকারি ডাক্তার হিসেবে যাচ্ছে, তারা গিয়ে যদি সেখানে পালস দেখতে না জানে, তারা যদি ফিটাল হার্ট সাউন্ড দেখতে না জানে, তারা সিম্পল একটা মার বুঝতে না পারে, তারা একটা লিভার যে বড় হয়েছে এটা বুঝতে পারে না, পেটের মাঝে যে পানি আছে সেটা বুঝতে পারে না, তাই তো এটা লজ্জার কথা। এটা কে শিখাবে আপনাকে? হোমিওপ্যাথি কলেজে শেখার সুযোগ নেই, বা হয়তো আছে কিন্তু নিচ্ছে না কেউ। এই জন্য আমরা এই ব্যবস্থাটা করেছি। আমি আশা করি যারা আমাদের ক্লাসে যোগ দেবেন তারা এই সাবজেক্টটা ভালোভাবে শিখবেন বলে মনে করি। আমরা যেমন ওই যে বললাম অটোস্কোপ কিভাবে কান পরীক্ষা করে, কিভাবে নাক পরীক্ষা করে, গলা পরীক্ষা করে, এই সবগুলো আমরা এই ক্লাসের মাধ্যমে শেখানোর চেষ্টা করব। তো আমি সবাইকে আহ্বান জানাচ্ছি এই ক্লাসটা মিস না দিয়ে আপনারা ক্লাসটা করেন এবং দেখেন এর থেকে কোনো পয়সা কিন্তু না আমি নিব না, যিনি কন্ট্যাক্ট হবেন তিনি নেবেন। আমরা ফ্রি দিচ্ছি, এটা জাস্ট আপনাদেরকে সৎকায়ে জারিয়া। এই পয়সাটা যাবে আমাদের পরিষদের ফান্ডে, আমাদের পরিষদের অর্গানাইজেশন অ্যাক্টিভিটির জন্য আমরা এটাকে এনরিচ করার চেষ্টা করছি। এই জন্য তো এই আহ্বান রেখে আমি শেষ করছি। ডক্টর আলমনাথ পাটোয়ারি।
Okay, sir, how can I be a member of Homeopathic Parishad?
Yes, fine. আপনি you can contact our general secretary of your district. Which district you belong to? Which district?
I reside in Dhaka, Mirpur.
Okay, nice. Then we have our general secretary in Dhaka. You can, okay, I can give you his contact number. You can contact with him. This is
Exactly.
very simple. You must be registered homeopath. You must have at least
Yes.
GST degree and registration, and you pay
Yes.
only 400 taka and you become a member. But you will have to be referred by some member that he knows you and okay, and you are practicing homeopathy, and also not patent homeopathy. This is
Okay.
this is
Okay.
good homeopathy.
So,
And you are a member.
Okay. So, how can I get the number, sir?
Okay, next class I'll give one announcement. Next class, inshallah.
Okay.
Thank you very
Thank you.
much.
Thank you
Assalamu
so much. জি, সালাম।
সবাইকে ধন্যবাদ জানিয়ে আমরা মনে হয় আজকের মতো এখানে শেষ করতে পারি। আর স্যার যেই ঘোষণা দিয়েছেন, আপনারা আমাদের বাংলাদেশ হোমিওপ্যাথিক পরিষদের যে ফেসবুক পেজটি আছে সেটা ফলো করবেন। আমরা সেখানে অ্যানাউন্সমেন্ট দিয়ে দেবো কত তারিখ থেকে আমরা এই পেড ক্লাসটা করব। আর আমাদের এই অনলাইন ভিত্তিক উচ্চতর প্রশিক্ষণ ক্লাসটি প্রতি বুধবারে নিয়মিতভাবেই হয়। আপনারা বুধবার ফলো করে যদি আমাদের সাথে যুক্ত থাকেন, আমাদের সকল ইনফরমেশন নিশ্চয়ই পাবেন। তো স্যার,
আরেকটা কথা আমি বলবো, এই ক্লাসটা আমরা বাংলাতে নেব, কারণ বেশি যারা অনেকেই যোগ দেবে তারা হয়তো অনেকে ইংলিশ ভালো বোঝেন না বলে মনে করি আমরা, এই জন্য ক্লাসটা আমরা বাংলাতে নেব। ধন্যবাদ।
জি, অবশ্যই। আজকেও ভালো লেগেছে একটি বিষয়, সেটা হচ্ছে কয়েকজন মন্তব্য করেছেন কমেন্টস বক্সে যে ইংরেজি খুব একটা বুঝছি না বা বুঝতে সক্ষম না, তবুও ক্লাসে জয়েন করেছি। বাংলা ভার্সনের ক্লাসটি কবে হবে তিনি জানতে চেয়েছেন। তো আমরা আপনার এই আগ্রহ এবং আপনার যে যুক্ত থেকে ইংরেজিতে শোনার অভ্যাসটা অন্তত তৈরি হচ্ছে, সেটার জন্য আপনাকে সাধুবাদ জানাচ্ছি। আর যারা ক্লাসের শুরু থেকে এখন পর্যন্ত যুক্ত আছেন প্রত্যেককেই আমরা আন্তরিকভাবে ধন্যবাদ জানাচ্ছি। আপনাদের এই শিখার আগ্রহটা এবং শিখে যে সমৃদ্ধি আমাদের মধ্যে আসবে, নিশ্চয়ই সেটা দিয়েই আমরা আত্মমানবতার সেবায় নিজেদেরকে আরো বেশি জোরালোভাবে নিবেদিত করতে পারবো। তো আমাদের স্যারের জন্য দোয়া করছি, আল্লাহ যেন তাকে লম্বা হায়াত দান করেন, আমাদের কিভাবে আরো দীর্ঘদিন শিখাতে পারেন, এবং আমরা যারা আছি প্রত্যেকেই যার অবস্থান থেকে সকলে নিজের জন্য দোয়া করবো, আল্লাহ যেন আমাদেরকে সুস্থতার সহিত দীর্ঘায়ু দান করেন। এই দোয়া কামনা করে আজকের মতো বিদায় নিচ্ছি। আল্লাহ হাফেজ।